Thank you, Mr Deputy Speaker. And this is my first address since the new parliament where you've been in the chair, and I want to say how pleased I am that you're continuing on the Speaker's panel, continuing to make a strong contribution to this parliament. Mr Deputy Speaker, I'm pleased to be making a contribution on the National Health Amendment General Co-Payment Bill, a bill which will have a positive impact and be warmly welcomed in the Shortland electorate. I thank the Minister for Health and Aged Care for his work on this very important legislation. This legislation will provide a reduction to the PBS, the Pharmaceutical Benefits Scheme, general patient co-payment by $12.50. This is the first reduction in the history of the PBS. This means that the maximum Australians will pay for PBS medicines will be $30. This is a reduction in cost of almost a third from the current rate. This change and cost reduction is sorely needed. We know millions of Australians are struggling with cost of living pressures, be it groceries, petrol or medical expenses. Under this legislation, around 19 million Australians will be eligible for the savings. Combined, these general patients could save around $190 million each year. People filling one script a month could save around $150 a year, while those filling 2 scripts a month could save around $300 a year. This is a key commitment that Labor took to the last election, and I'm proud to be part of the Albanese Labor government that is delivering this cost of living relief that is desperately needed. Unlike the previous Liberal government, that was all announcement and absolutely no delivery, we are seeing a markedly different approach to delivering on our commitments from the Albanese government. And this bill is significant in that delivery. We are actually delivering tangible cost of living relief to millions of Australians. And unlike the last government, we're not waiting to 2 minutes to midnight before an election to make an announcement when they had 9 years, almost 10 years in power to do something, but they did nothing. And Mr Deputy Speaker, in a prosperous and wealthy country like Australia, no one should be forced to pick between accessing vital medication or putting food on their table. Yet that's exactly what so many Australians, including people in my community, are doing. We know that over the last 9 years, the previous government was obsessed with attacking Medicare and our healthcare system. They cut bulk billing incentives for doctors. They reclassified the Hunter and Central Coast regions as not being a priority area for GPs, which has led to a significant GP shortage. They cut funding to Hunter's vital GP access after hours service, funding that the Albanese Labor government will restore. All of those changes made it much harder and much more expensive for people in my community to see their GP. But patients have also been hit with a double whammy of their vital medicines becoming increasingly unaffordable. The co-payment that general patients contribute to the Commonwealth to sustain the PBS has doubled since 2000, and according to ABS figures, more than 900,000 Australians delayed or didn't get a script filled in 2019-20 due to the cost. This is just plain wrong. Former Prime Minister Gough Whitlam said in 1975 that the purpose of universal health care is to make medical treatment available to all who need it, to ensure that medical care is not just another marketable commodity but a right of every citizen. All Australians should have access to universal, prompt and world-class medical care, and no one should have to choose between filling prescriptions for potentially life-saving medicines and providing for their families. Unfortunately, many of my constituents currently don't have this choice. They have to choose, in fact. So, Mr Deputy Speaker, of course, this Labor government is committed to enacting progressive and meaningful health policies that positively impact the lives of many Australians. And this builds on our strong history. Labor introduced visionary programs such as Medicare and the National Disability Insurance Scheme, and it was that great Australian Labor Prime Minister Ben Chifley who established the PBS in 1948. It wasn't easy. It took 2 court challenges, 2 referendums, a constitutional amendment and 16 years to embed the scheme. Yet almost 80 years on, it has helped the lives of so many Australians. Mr Deputy Speaker, Labor has been in government for only a few months, but we have already put our money where our mouth is when it comes to improving the health outcomes of Australians. One of the biggest issues my constituents face is finding an available appointment with their GP, or finding a GP that takes new patients. This is one of the biggest concerns they raised with me in the lead up to the recent election. And as I mentioned earlier, the GP shortage in my community is a direct consequence of the previous government's decision to reclassify the Hunter and Central Coast as non-priority areas for GPs. So I was so happy that in July, exactly 2 months after the election, the new Labor government reversed these changes. Medical practices in my community can now access doctors from the bonded medical program as well as overseas trained doctors, making it easier for them to recruit more GPs to our region. This change will not only take stress off local GPs, it will also reduce patient wait times, making it much easier for them to see their doctor. The new Labor government has also delivered on our commitment to give all 130,000 Australians with type 1 diabetes access to subsidised continuous glucose monitoring devices under the National Diabetes Services Scheme. These Australians over the age of 21 be able to access CGM products through their pharmacy with a co-payment equivalent of $32.50 per month or $390 per year. These life-saving devices were previously costing them up to $5,000 per year. Similar to the legislation we are discussing today, this measure will help ease health costs for people living with type 1 diabetes. Not only that, having access to these devices will save lives. Unsurprisingly, delivering this election commitment was welcomed by many people in my community. Nicole said to me via Facebook, as a mother of a T1, this brings music to my ears. Andrew was equally pleased, saying, I've been diabetic since 1994, and if it wasn't for the subsidies, I would be broke. The free glucose monitor is another plus. And Jessica said, this is amazing news. I received an email last week from NDSS and nearly cried. I haven't been able to access the CGM since having my son. Financially, it was totally out of reach. This is absolutely life-saving stuff. And that brings me back to how important the legislation we are debating today is. It will save millions of Australians hundreds of dollars a year on medication they need. This is what Australians expect from the Labor government, a government that cares about their health and their ability to access affordable medicines. And concerns about the rising costs of medicines is something that I regularly hear from my constituents about. Martin from Warners Bay is on the disability support pension. He told me that he pays over a quarter of his pension on medication. He said, I have 5 that are non-PBS, despite some of them being considered the most effective for my condition and the kindest on my body. There is one drug that I pay $40 a month for, and it has less ingredients than one on the PBS that would cost me $5.50. Caroline from Cahaiba is on a part-age pension and contacted me about how the rising costs in medicines is impacting her family's budget. She said, I've been on prescribed melatonin for a number of years. All this time I've been purchasing a 3-month supply from a compounding pharmacist. I can now only get a month's supply at a time at a cost of $35. I was paying $75 for 3 months' supply, and I could claim all but $40 of that back from my health fund. So from costing me $10 a month, it's now costing me $35 a month. This is a lot extra from a limited income. We do the right thing and pay for private medical, but when things like these changes occur, it makes it less attractive to be covered. These are just a small handful of some of the feedback I received from the Shortland community. As a member of this place, it's imperative that I listen and act on the concerns of my constituents. It's also vital that we bring forth real reforms, reforms that will transform the lives of so many Australians. As an electorate that is on average the 6th oldest in this country, health care and the need for better health services are issues that the Shortland community are rightly concerned and passionate about. Over the course of the most recent federal election campaign, my team and I door-knocked thousands of doors and called more than 20,000 Shortland residents. Over and over again, health care and the cost of health was identified as the major issue of importance for my constituents, particularly the cost of health care dramatically increasing over the last decade. And that's why this legislation is so vital. It demonstrates yet again that the Albanese Labor government is committed to addressing these cost of living pressures that Australians are facing in these uncertain times, This legislation delivers on that commitment, and I commend the bill to the House.